Hello, I'm Dr. Mark Bringleson. I'm the clinic director here at Life Wellness Center here in Stafford, Virginia. I've been helping people with crash injuries for over 23 years. We have some very unique and effective treatments here that substantially change people's lives for the better. Today I want to go over with you some basic anatomy of the parts that could be involved in your injury. Tell you a little bit about what a good comprehensive exam would look like, so if you go to the doctor you'll know if you're getting checked out properly. Tell you about the therapies and the procedures and the treatments we do to make people better. Also go over some frequently asked questions that surround a crash injury that is quite confusing at times, because it's the first time you've been involved in a crash injury, but the lawyers and the insurance companies, they do it all the time. You need to know a little bit. Now, when it comes to injuries in a motor vehicle accident, most of the time it involves the spine. A lot of times there's a low impact collision, just 5, 10, 20 mile an hour impact can cause substantial injury. And these are some of the parts that are involved. The spine. The spine is a stack of 24 movable bones that's connected together by different joints, the discs, and ligaments and muscles. The bone comprises these parts. You've got your spinous process in the back, little processes around the vertebra here where muscles connect so the vertebra can move and bend, and they can get injured in the auto accident where the muscles connect. You have joints on either side of the vertebra that are just like your knuckle joints in your hand. You have the disc that's between the vertebra right here, okay, that the spine connects to one another. Each vertebra connects to one another with the disc. Then you have the nerve that comes out between each vertebra where there's a hole that's made between the vertebra. And there's also a vessel there, okay? So those nerves, they control all the body parts via the spinal cord and brain. You've got your spinal cord on the inside, okay? All these parts are involved in the auto accident. They can get injured. Now the spine has a certain shape to it that's important. A good strong spine should have these curves in it from the side. Should have a forward curve in the neck, a backwards curve in the mid-back, and a forward curve in the lower back. A lot of times in an accident, vertebrae are knocked out of a line and you can lose this normal shape. Therefore, when you lose that shape, muscles have to work harder to hold the body up. That's where you get muscle spasms, muscle tension, tight muscles. Okay, so you can lose the shape this way, okay, and then you can also lose the shape straight on. When you look straight on to someone, the spine should be straight. This is when you should have a straight spine. Of course, you see the nerves, how they come out between each one of the vertebrae, go into the body parts. Now, muscles are in a layered fashion on top of the spine. You've got little muscles that connect between vertebra, 2 or 3 vertebra. Then you got more vertebrae that are connected, and then even larger muscles out to the side that all help to hold your body up, move the body, move the spine. And in a crash injury, the little connections where the muscles connect to the vertebra, they get sprained and get strained and torn. Also, the muscle gets stretched pretty hard, and then they can get sprained and torn. Okay, now also the nervous system's involved, and between each one of the vertebra there exits a nerve, and it will give sensation to different levels of your body. So the doctor may test these different nerve levels with using what we call a pinwheel or a little sensation tester, okay, on different areas, and you can determine what nerve is involved, nerve root. The nerves work like this. The brain sends messages down through the spinal cord, okay, to the muscle, okay, controls the muscle, and then there's sensation that comes back from the body via the spinal cord and nerves back to the brain. Now, there's an interesting phenomenon that happens when you get in an injury. A lot of times you get injured with the spine and it causes pain. Well, pain signal can come from the spine, send a signal right back up into the brain that says, oh, there's a problem, and then the brain will send a message right back to the spine and create a muscle spasm. And then that spasm will cause pain and will create this feedback loop called the pain spasm cycle, and this is what can keep spasm going on in your back for a long time because there's such dysfunction with this. So That's when medications can help. A lot of times you can help to break the pain spasm cycle. But of course, there's other injuries involved that you want to rehabilitate so this won't continue to happen. So next, let me tell you a little bit about how the nervous system is so important and why you do not want to leave your spine out of line. Because, of course, you can see here from the brain through the spinal cord, exiting the muscles, you have nerves that go to your body parts. Your heart, your lung, your digestive tract, your immune system, endocrine system. Your nerves control everything. So when your nerves aren't working right, your body might not work right. So when you get involved in an auto accident, you can have other problems also. And these can manifest many years later or not too long after also. So as you can see, got your brain sending the message down to the heart, and the heart sends message back to the brain. So you want to make sure all of those connections are doing well. Now, when it happens, you can get hurt, okay? So let me tell you a little bit about what's going on here. Now, in a rear-ender collision, it's called whiplash, because in the accident, the spine goes through a whipping type of motion, and that motion creates abnormal function between vertebrae. The head doesn't just easily flip backwards and then go forwards. Like I said, there's a waveform that goes through the spine. Now the vertebra normally will move forwards and backwards together, but in an auto accident, they're going to move opposite one another at individual levels. So everything that's between the vertebra there can get torn. So that means your ligaments and muscles, and then the nerve that comes through can get bruised or stretched or hurt. And that can focus on certain levels, maybe in the lower neck usually. Okay, you can tear ligaments in the front or in the back, those sort of things. Now when you tear tissue, it usually ends up in scar tissue. Good healthy tissue has good blood flow, good elasticity, everything's happy. But when you strain the tissue, it breaks down, you've got pain and dysfunction or lowered function, and then scar tissue develops. And scar tissue is like haphazard laying down of fibers. And I'm going to use this little prop to show you what's going on here. You've got healthy tissue that's got fibers running in it in a good longitudinal manner, kind of like a rope or a sheet or a cloth. It's good and strong, okay? But in scar tissue, the fibers all lay down in a haphazard pattern, kind of like a paper towel, where they just, fibers are different areas. Now if you put that together, you give a little strength to it, it tears real easy, okay? So that's the deal with scar tissue. It can leave your spine weaker, more susceptible to injury, and it's also more sensitive and can create a lifelong problem. Like, when you sprain an ankle, it keeps being sprained again and again. So that's the reason why. Now, now let's talk about what it looks like on X-ray. The neck is the most susceptible part in the auto accident. Like we talked about the curves in the spine, here's a good curve in the neck from the side. Should have a forward curve like this. But a lot of times it gets so out of whack that it goes straight. So that's a big change. That's why your neck hurts. Even a 8-mile-an-hour impact can screw your neck up. Now in an 8-mile-an-hour impact, you can get 5 G-forces into the head and neck in a third of a second. That's that fast. So imagine that whip action going through your spine, affecting even the mid-back and neck and stuff like that. So that throws the whole spine out of balance. And that's why a lot of people are hurt, even after a low impact collision. Okay, so that's significant. Now, here's some of the areas that can get injured in an auto accident around the vertebra. Now, you can injure the ligaments on the inside, so it ends up becoming very hypertrophic, meaning it grows bigger and starts irritating the spinal cord. The joints, over time, here's the joints like we talked about earlier. The joints over time can create spur formations over the long term. And then if you leave the spine out of balance, the disc, it starts breaking down. Then you start getting what we call a disc bulge. You've heard of a slip disc and things like that. Now, this is the long-term effects of leaving your spine out of balance. Sometimes you hurt, sometimes you don't, but your body deals with it the best they can, but there's a way to change it, the way to improve it through good spinal care. Now, some research has found that you can have long-term problems. So the research shows this. So don't necessarily listen to your insurance adjuster who says, oh, you'll be better in 5-6 weeks. And you might feel some better because the swelling has gone down. But this dysfunction stays there for a lifetime unless it's repaired. You may even be sent to a medical doctor who is you've been sent to that medical doctor by your insurance company, who's usually trained to tell you or tell everybody else that you're not hurt. So that's not good. And he'll tell you that you're fine within 6 weeks, but you're still hurting. And this is the evidence that proves it. Norris and Watt found that 90% of the people involved in a rear-end collision were symptomatic at 2-year follow-up. That's no big deal. Listen to this. Nunn found that 50% involved in a motor vehicle accident had significant pain, a lot of pain, at 5-year follow-up. Hodgkin found that 62% of the people involved in a whiplash injury were still symptomatic after a 15-year follow-up, okay? And that was opposed to 15% of the people who were symptomatic compared to other types of injuries. So just comparing two different types of injuries, whiplash was significant. It's because it leaves the spine out of balance and out of line. So it has to, it's just not in balance anymore, so it can be dysfunctional for a lifetime. So Watkin found that 86% of the people involved in a rear-end motor vehicle accident were still symptomatic after a 10-year follow-up. Again, we got this one here. We got a 10-year follow-up period. 88% were still symptomatic, and they found that 40% were significant. And that relates back and confirms that, back to Nunn, that 50% were significant at a 5-year follow-up. So it's not just a little ache and pain you're going to be dealing with. So what does a good exam look like? So when you go to the doctor, you want to get thoroughly examined. You want to get a detailed history. We want to talk to you about what happened, what position you were in the crash injury. Were you looking to the left, or were you looking down? If you weren't upright and straight and your head back against the back headrest, you're more likely to get deeper injury because the head was not supported. So when you're in a crash, if you think you're going to get into injury, you want to make sure you sit up, bring your head back to the headrest, and hold on and brace, okay? Being unbraced is a factor for more injury because your muscles aren't supporting your spine. You're just allowing the whole whipping action to go right through your spine. And if you're looking this way or a different way, it compromises the joints in a certain way, so you'll have different focused energies right into certain areas of the spine. That'll lead to deeper problems. So that's significant. You might be an older person who've been in other injuries in the past. Even though some old degenerative arthritis is in your spine, you're doing okay, but the crash will stir that up and lead to longer term problems and more significant injuries. So that makes you more susceptible and a worse prognosis. So don't let these insurance adjusters tell you you should be fine by now, okay? So there's reasons why you still hurt. And a good doctor is going to pull those out and document those and explain those to the people who are involved. You want to get a good physical examination. You want to identify areas of other injury to make sure you don't need to go see any specialist because of any deeper injuries. There's other injuries that could happen, like the TMJ joint. You might need to go see a specialized dentist to have your TMJ, your jaw joint, looked at. And sometimes I can help that too with some special therapies I have. You want to do a very good, thorough spinal exam, not just touch you down the spine or just look at you and say it's just a muscle spasm, you're going to be okay. Again, the spine gets out of line, it gets dysfunctional, so you need to look at the range of motion, how your vertebra and how your spine's moving, palpate from the top to bottom to see if the muscles are in spasm. You want to check your posture, if you have a high shoulder, if your head sets out forwards, if you're looking twisted. All these are indicators of the spine's is out of balance. And not to mention the least is the neurological component. You want to check your cranial nerves. A lot of times the injury happens right here at the brainstem, top of the neck. You want to check your cranial nerves. You want to check the peripheral nerves to the hands and feet. Back to that area where the nerves distribute throughout the skin. You can check and see if those are injured, okay? So you also may have had a mild traumatic brain injury where the brain gets sloshed around into the skull, and that can create diffuse inflammation in the brain, and that can lead to long-term problems also. So you want to see a doctor that's going to look into that. There's blood tests to do to find out if you've had a mild traumatic brain injury. There's also some diagnostic studies to do to make sure that's documented also. And then a good set of x-rays to see what the spine looks like, and other joints if need be. Now the doctor should also document to make sure it's well recorded what you're going through, so that when the time comes when you need to settle your case, it is explained fully to the opposing attorneys, the insurance company, and things like that, that you've been hurt and what you've gone through to get well, and if you have any future problems that you need to be explained, those need to be explained to the powers that be. So you need to have a doctor that can manage all that properly. You're not just going to go get some medications and hope to get better, and you see the doctor occasionally, okay? So let's talk about what's the good part, what kind of treatments we do to fix you, okay? So we have a very comprehensive program here. I want to cover all the bases to make sure you're well for the rest of your life. I'd like to get you even better than you were before the crash, okay? There's always something going on in people's spines. We do a specialized type of chiropractic care called advanced biostructural correction. We also use whole body vibration with posture weights. What that does, it helps to rebalance your posture. This is my baby right here, MLS M6 cold laser therapy. That's an amazing piece of technology that helps to heal the tissue, helps to really heal the tissue. Pulsed electromagnetic frequency therapy is also a stimulatory for healing. This does more than just increase circulation or kill pain. This stuff really triggers tissues to heal and does enhanced healing. And some good old standbys, interferential current therapy. You might get this at your physical therapist. We have that. That's great. That's like electric massage. That feels good. And rehabilitative exercises and things like that. Now, advanced biostructural correction is a precise spinal analysis where I actually use your body's balancing system to tell me exactly what's out of balance or what's out of a line in your spine each time you come in. So it's a very precise analysis to find where misalignments are in a very precise correction. So we're no rack-em crack-em type of chiropractic here. We want to get very specific and cause the spine to change its posture. That's what we want to do, is get an upright posture. There's all different types of shapes the spine can go through. Now, you want to see how I do this? Go to my website at relieffrompain.com under services, and you can watch me do an adjustment. It's very safe, very effective. And if you have any fears or anything like that, I always will baby you through everything and explain everything, no pulling of any surprises, and if anything doesn't feel good, we'll make sure you're comfortable. I care about you getting well. Now, whole body vibration is pretty cool. What it does, there's a vibrating platform that helps to, it just vibrates the body. And when we put these posture weights on your body, it counterbalances your postural imbalances. So it super stimulates all the muscles involved that are needed to correct your posture, and also helps super stimulate the brain to help understand what normal posture is. And it looks a little like this. So you're on this platform, standing up, and usually we'll have some head weights and posture weights on the body. What whole body vibration does, it helps to increase muscle tone. It really does that. Increases bone density mass, improves circulation and throughout the body, and increases balance too. A lot of people with balance disorders will use this, and it might even help with some weight. Okay, but when we're talking about stimulating healing, this is the cold laser that I have in the office. It's the best laser on the market. It goes deeply into the body. It sends couple different wavelengths of light into the tissues. those two different wavelengths of light are absorbed in your tissues a lot like the sunlight is on a plant, kind of like photosynthesis. And we've discovered this. Laser's been around for 40 years. It started out in the veterinarian industry, and animals were getting better, so why not use it for humans too? But we've really advanced in this technology, so increases blood flow, it decreases scar tissue, increases collagen production too, strengthens muscles, decreases inflammation, stimulates nerve regeneration, all kinds of great things to cause that body to get well. So we can really change even chronic problems. People have been hurt for years. We can help that area that's slow to heal. And particularly when you get in a crash injury, you want to make sure the body heals quickly. And because, like we talked about that scar tissue, when the scar tissue starts laying down in a haphazard manner, you want to get the spine in line, so the fibers that are healing heal in a longitudinal pattern. So you want to heal them in line, and also you want to heal them quick, so it just doesn't keep laying down layers of scar tissue. And if you don't get care fairly rapidly, you can have long-term problems because you didn't get treatment. Okay, so we also use pulsed electromagnetic field therapy. It does a lot of the same things the cold laser will do, but it helps to balance the electrical potential across the membrane, the cell membrane, so there's better exchange of nutrients and toxins out, nutrients into the cell, so it helps stimulate healing in that way. And you're not going to find these type of therapies in your physical therapist's office or many other chiropractors' offices. Or your orthopedist's office. These are advanced therapies, trying to always find what's working best for people. But sometimes we have some old technologies, okay? We've gotten rid of this one. We got a new one, by the way. But what traction does, it helps to decompress the discs in the spine. When you open up the spacing between the vertebra, you can pull in good fluids and nutrients back into the disc, and it helps to, again, rehabilitate some of that scar tissue around the area. So that's good. Now you could choose to use this one in our office, or you can use this one. This one's better, by the way. Additionally, dealing with this scar tissue and dealing with muscle spasm, this is an awesome piece of equipment called the Adhesion Release Stimulator, ARS. This little device sends a waveform of vibration down through the tissues, and that waveform is the same frequency or same resonance of scar tissue. So when it sends that waveform, that resonance through the connective tissue, it'll create this vibration that helps break up scar tissue again, and only the strong fibers survive. This helps also to break up spasm. Patients love this. I like it too. So we do all these things in order to help you. We also do rehabilitative exercises to strengthen the muscle and scar tissue. Always making sure you're doing some things to get yourself well at home. Okay, important to do special nutrition and special diet, especially when you're injured, because you want to control inflammation the best you can. That's where the pain is at. If you can reduce that inflammation, you feel better faster. Now, what's the care process like? Okay, this is what it's going to be like when you get under care. We're going to usually see you, it depends on how bad you're in pain. Might see you daily, okay? Then we'll probably see you about 3 times a week for 2 to 6 weeks. You've been hurt pretty bad, you've got a bad problem, we're going to work on you frequent enough to get you out of that hole you're in. And then the frequency of care is going to decrease. Care may last between 2 to 5 months, okay? Depending on how bad you're injured. Try to get you out as fast as possible, but keep you in care long enough to make sure you're strong and rehabilitated, so when you go back out there in the world, you won't have your problem returning. Care may last about 45 minutes to an hour each time you come in, okay? And what type of results are you going to expect? I want to see you getting better than you were even before you came in, okay? And most people do. I work hard, people feel better. They're stronger because most people have not had their spine aligned ever, okay? So when an auto accident happens, we're going to start aligning that spine and rebalancing it, and you're going to learn a lot on how to take care of yourself also, okay? So I expect some improvements in about 3 visits. see some improvements, range of motion, pain level, pain frequency, those sort of things. So that tells us, hey, we're heading the right direction. But over your course of care, you might have some ups and downs because the spine, your body has been hurt, it's weak, you're living in the real world, so you might have some ups and downs in the beginning. You're going to be feeling better, and some days not so good. So kind of be ready for that. But for the most part, good days take over the bad days. And I expect you to have full recovery, okay? Full recovery. And you might need some future care just because, you know, it's important to take care of your back, okay? And so, now there's other questions people have that surround crash injury, okay? But I want to tell you what you should do, all right? You should always seek medical treatment after you've been involved in a crash. All right? It's very important to document that you've been hurt, all right? Not only to get yourself some help, but you want to show the people who are watching your case that you're taking care of it, okay? Go to the hospital, go to urgent care, very important. Follow up with corrective care. That would be a good chiropractor, physical therapist, and very important to stick with your care. If you got to show continuity of care. If you start feeling better rather rapidly, that's great, but just don't discontinue care because that screws up. If you have a lawyer, they really hate that because that screws up your case, okay? And the opposing attorney will use that to show that you don't have any injury. So stick with your care, very important. Follow through with your recommendations, okay? Show that you're trying to get well, extremely important. Now, also something else you should do when you've been involved in an auto accident is document how you feel, how your body and life has been affected by what has happened. If you document it, put some real life story in there, people can understand what has happened to you. And you can also go back, if your case doesn't settle but 2 years later, even 5 years later sometimes, you can go back and read that to the court or to the other opposing attorney that, hey, this is what I went through, okay? And again, remember the research. You may still have these problems and you want to be taken care of. Just remember, the insurance company is not your friend, no matter how nice they are to you, okay? Again, record your work, your hobbies, what's going on with your hobbies, if you had workouts, maybe information from your family and coworkers, how you were affected. So, should you get an attorney or not when you've been involved in a crash injury? Unless you've got a lot of moxie and a lot of ability to deal with people, I say hire an attorney, okay? Actually, I don't say it. A lot of authorities say it also, and that's my experience. It's good to get a good attorney. And it's important to get a good attorney, okay? Do your research. We refer to some good ones around here. I want you to be fully taken care of, so you don't have any stress. It should be a good experience. So it's kind of hard to have a good experience out of a crash, but hey, we want to try to do the best we can with that. So research for a good attorney. Take all your medical info and your crash information to your attorney. Yes. So they can determine what kind of case you have. Very important. Now, when you get hit, it takes you by surprise, of course. How are you going to pay for it? What's going on? You might have health insurance that can cover your care. That's great, but you know health insurance only has limited coverage, okay? You may have medical coverage on your auto insurance. I suggest you get that if you don't have it. It's very helpful, all right? Also, the doctor may take a lien with your attorney that they will get paid at the end of care. I do that with my patients. I find that that's very helpful, so everybody can get well. I'll be taken care of later. That's just fine. There's different other services you can get called MedCheck. MedCheck is a service that'll pay for your care up front, kind of like a healthcare credit card. They'll get paid from your settlement, kind of like what I do with attorney lien. There's another situation called Global Cash Advance, which you can utilize, and it's through the same company that will help pay for some of your work-related problems if you can't work or something like that. So they can help pay for that. Okay, so hopefully this has given you some information that you can utilize and kind of give you a broad overview of what to expect out of a crash, okay? Now, what should you do next? You should make an appointment. Please make an appointment with me. I'll take good care of you. Call me at 720-6000. You can go online, make an appointment, relieffrompain.com, okay? You can bring some of your information from your doctors and things like that. We can request that information so you don't have to stress about all that, okay? So, but I want you to know, I want you to live your life well, and we'll do that for you here at the Life Wellness Center. Thank you for listening, and give us a call. God bless.